Welcome to the skill set and demonstration of central line dressing change brought to you by Northwell Health's Institute for Nursing. Before the demonstration begins, let's review some important points to remember when performing this procedure. First, check the patient's isolation status. If on isolation, follow the system policy. If not on isolation, follow standard precautions. Before entering a patient's room to perform a dressing change, please have all supplies that are needed, such as a set of clean gloves, a central line dressing kit, blue claves for each line, and one mask for your patient to wear, as there already is a mask for you to wear within your kit. Also, please check at your site if a bio patch is used during the dressing changes, and check if the kit at your site includes this bio patch. Now, clear off an area to designate as your sterile field. The area should be next to you. Ensure you do not cross over the area, so keep this in mind before setting up your sterile field. Ask your patient to wear the mask you brought in, and be sure to explain the reason. If they choose not to wear it despite education, ask them to please turn their face away from the site during the procedure. Always check allergies, and if allergic to chlorhexidine, follow your site policy. Central line dressings must be changed every 7 days, or PRN, if soiled or begin to loosen. Dressing changes will be communicated and must be communicated in handoff and documented in the patient's chart. For more information, please refer to the System Policy and Competency located on the Northwell Health's intranet.
Welcome to our procedure for central line dressing changes. First, we're going to gather our appropriate supplies and equipment, which we've already done. Then we're going to perform the 5 eyes. Introduce yourself.
Hello, my name is Laura. I'll be your nurse.
Identify the patient.
Can you please state and spell your first and last name and date of birth?
Sure. My name is Katz Jackie, Katzjackie, and my date of birth is March 17, 1927.
Great, perfect. That matches your ID band.
Then inform the patient.
So, Ms. Katz, right now what I'm going to be doing is changing your central line dressing.
Sure.
Include the patient. Check and verify all allergies.
Ms. Katz, I'm going to be performing this dressing change. I wanted to be sure, do you have any allergies?
I don't have any allergies.
Okay, great. So what I'm going to be doing is I'll explain step by step how the procedure will go.
Thank you.
You're welcome.
Perform infection control by doing hand hygiene.
Ms. Katz, first I'm going to perform hand hygiene, and I'll be washing my hands with soap and water for a minimum of 15 seconds.
Thank you. I'm so glad you're washing your hands.
Absolutely. And then I'll be putting on gloves.
Create a clean work area to designate your sterile field. Place a mask on the patient.
Ms. Katz, I'm going to ask you to wear this mask, please. And the reason is so you don't breathe on that area. We want to make sure there's no contamination.
Okay.
Open the kit and place a mask on your face, yellow or blue side facing outward. Remove the old dressing and discard. Please remember, when removing the dressing, ensure to first loosen the outer edges and then pull towards the insertion site, reducing the risk of dislodging the line. At this time, assess the site for evidence of any signs of infection.
Okay. No redness, drainage.
Then remove your non-sterile gloves. Perform hand hygiene and may use sanitizer that comes in the kit, always using friction until your hands are completely dry.
Okay, they're nice and dry.
Open the sterile kit and be sure to remain careful as to not contaminate the inside of the blue drape. Make sure to pull only on corners while turning the kit to reach each side and not to cross over. Don the sterile gloves.
Tricky.
Open all supplies and have them ready for use. Using an alcohol swab stick, start at the insertion site. Cleanse the skin in a circular motion to cover 2-inch area around the catheter. Repeat using each stick, all 3, ensuring not to return to the insertion site. Allow to completely dry, never fan to dry. Using a chlorhexidine swab stick, there is just one. Start at the insertion site and cleanse the skin using friction to cover at least a 2-inch area around insertion site and outward. Allow it to completely air dry. Using a skin prep pad, create a window frame with the pad in order to prep skin under where the sterile dressing will be placed. Ensure the skin prep is completely dry, no fanning to dry. If the white securement dressing or Statlock is used at your facility, you will apply it at this time. Apply the sterile transparent dressing, ensuring that slits are placed over the catheters. Hold gently for several seconds to ensure it adheres well, and then remove the outer paper. Dispose all supplies. Remove gloves. Perform hand hygiene. Complete the label and place it on the dressing. And be sure not to cover the insertion site. Then document the procedure in the patient's chart.